Hey everybody, welcome back. We are now at the Jacobs School of Medicine on Main Street downtown, an absolutely stunning building to not only talk about what is inside and some of the capabilities and some of the new news that's happening with Jacobs School of Medicine, but also introducing to you the Vice President and Dean of the Jacobs School. This is Dr. Allison Brashear. She is mic'd up herself, and what I'd like to do is not only thank you for joining us here on Buffalo Brief and welcoming us to the Jacobs School of Medicine, but to talk a little bit about yourself, because you have a very extensive biography in order for you to get to where you were to where you are now.
Well, thank you so much, and thanks for joining us here at the Jacobs School in downtown Buffalo. One of the things I think about me is I'm a neurologist, and I am the dean of the medical school, and I make sure that we train the next generation of physicians, but also that we do research that is impactful to our region, and we're trying to really transform the lives of the individuals in Western New York. And I do research and see patients and all the things that come with being a doctor.
Now, you were just recognized by Representative Tim Kennedy upon your election to the National Academy of Medicine. Why did he do that? Why is that a big deal in this field? Obviously, it's a part of a pretty exclusive group.
Oh, well, thank you so much, and I'm really honored that the congressman did that. It was a big surprise. So I was elected to the National Academy of Medicine in October, and there were 90 people elected, and that happens every year, and it is based upon your qualifications in leadership and research and education across the health sciences. So I'm very honored to join the group, and I'm looking forward to working with them on a variety of different projects.
How will that group impact us here in Buffalo? First of all, our students and residents, our Jacobs School of Medicine as a whole, the funding maybe that comes here. How will that impact us?
So the National Academy of Medicine is it's an organization that people are elected to. Then the Academy does work. They don't necessarily fund work, but they are a connection to all different organizations. So I'm deeply involved in the AAMC, which is the association of all the medical schools in the country, and I'm the chair-elect of all 160 deans of the medical schools in the country. So all of these things are about building relationships, and my goal is to shine a bright light on everything that's going on in Buffalo and here in Western New York, and bring people in to see the amazing work here.
Yeah. Should we see the amazing rooms that we have here?
I think we should.
We'll be glad to show you.
All
yes,
right.
Absolutely.
You lead the way, doctor.
Okay, so we're going through here, and this is actually onto our simulation. So what this is this is a simulation center, so that it is where students and residents come and learn about what it's like to take care of patients in a hospital. So one of the things is that one of the things is that you want to role play. So we have patients who come and they're role play with simulation patients. We have mannequins. We have also people that come in, and we do that with medical students. We do that with residents, people out of medical school. And that means then they come in and they do things. And so sometimes you'll walk up here and there'll be like a code, and you'll hear all this, or there'll be all kinds of excitement going on. And then we also have a clinic next door, which is the same thing, which is closely monitored. You can have beds, and one of the mannequins actually gives birth, and all these kinds of things.
Wow.
Okay, so basically, how does a resident, or does the residency program works? You kind of went through that before when it comes to a person will graduate, and then is that their white coats ceremony, or does that come later? How does that all happen?
So you go to medical school, you graduate with a bachelor's, and then you come to medical school, and then you graduate in 4 years and then go on to do a residency. The white coat ceremony is when the medical students get their short white coat.
Got it.
And then Match Day, which is in March, so we'd love to have someone come and watch Match Day. Match Day is in the middle of March, when all over the country, all the medical students who are graduating open up their envelope all at the same time. Here it's noon. In California it's 9 a.m. and they figure out where they're going to go for their residency program. And so that's a really big deal. One of the things that we're doing is that we are going to propose to have a pathway for students to graduate from medical school in 3 years instead of 4.
Wow.
Those would be students who commit to primary care, and we have been awarded a grant with ECMC from the state to build out primary care for the East Side. So we're proposing that students who commit to primary care then would finish in 3 years. We would have them have a residency, and then they would commit to working in the East and West Side of Buffalo for 5 years. And so that is a work that we have worked on for a long time, and it's built upon a consortium across the country of 25 medical schools who are doing this now. When I was the dean at UC Davis, we did that as well. And so it was a way to build out primary care in a very deliberate, focused fashion.
That's amazing. Are there any of these suites that we can pop our head in, our camera, by chance? Connor here is going to maybe show us one of them.
Absolutely.
Five.
Okay, down here.
All right, it is.
Go down here. The primary care conversation we want to have, because that is another part of these sort of announcements that are happening here. Room 3? Okay.
All right.
Yes. So the primary care initiative, and as you can
One
see,
second, there was a
Person.
person in here. That is a mannequin.
you can see that the medical school is in downtown Buffalo. And part of the primary care initiative is because we seek to transform the health of Western New York. And one of the ways you do that is by having a primary care doctor. They say in Buffalo that everybody needs a quarterback, right?
Very good.
And that's what a primary care doctor is. They're the one that kind of call the place for you, decide whether you need a specialist, make sure that you do your preventive care. And that does a couple of things. Number one, it's very patient-centered. Number two, it should keep people at home with their friends and family as much as possible. We don't want people getting their primary care in the emergency room. It's not cost-effective, and it's not good for patients. And our emergency rooms need to take care of people who are really, really sick and need to be there. So we also think that by building out primary care that we can lower the cost of care. Sure. And that's important for everybody. That's important for the state, that's important for the hospitals, and it's also important for the businesses in our community, because we want to make sure that the cost of care is reasonable, as that has been going up through the ceiling, right, recently. Everybody's aware of that, particularly with the current changes in the ACA benefits.
You hear about the overuse of emergency rooms all over the place. You really hear about it. I feel like in Western New York.
Yes.
How big of a problem is that here in maybe the city or in Erie County? And how much of it has to do with the number of doctors or available doctors there are in this area?
I think it's a multi-pronged problem. It is one, access to care, so people being able to know how to get access to care. And again, when you have a quarterback, a primary care doctor, you're likely to have someone managing your care. Number two is when people don't have other appropriate support, they end up in the hospital, and then they can't get out of the hospital because they don't have transportation to get to the doctor, they don't have home, or they don't have someone to care for them. And so by keeping people at home and not getting to the hospital and just getting admitted, I think we'll be able to benefit that. But it is a multi-pronged national problem, and so we're trying to be very focused, building upon what's been done in other communities.
That's great.
And why do we have a lack of primary care doctors?
That's also complex. So one of the problems is primary care, people graduate with lots of debt in medicine, and then primary care is not well reimbursed by the insurance companies, even though we can make a case that it would lower the cost of care. Secondly is people will need to have role models and see people who are wonderfully successful in primary care. And one of our best role models is Dr. David Milling, who's our Senior Associate Dean, who practices at ECMC and takes care of patients. And so we have done a lot to really hold up primary care as something that we think is really important. And we're also still very much training specialists. We graduate 180 medical students every year, and we are really working hard to keep as many of those here in Buffalo as possible. And that's part of the primary care initiative, because if you get a scholarship, you're going to work here and do your training here and stay here. And there's really good data to show that if you go to medical school and do a residency in some place, you're more likely to stay and grow roots and, raise a family, et cetera, and become part of the Buffalo community.
As we move on and look at some of that primary care area simulations, I'm curious, are we finding more of that, what you just said? Are more people staying because of this facility, because of literally the physical aspect of what this place offers?
Well, I see the fact that we put the medical school downtown as a real driver of economic development for the region, right?
Big time.
Healthcare is a big, big growth area, and that is something that I think we can build around here in Buffalo. We've got great hospital partners. The medical school partners with everyone, and the fact that we grow more doctors, more nurses, more social workers, more pharmacists, more people who do public health. Those are all going to be great things for Buffalo.
Yep.
I would be remiss if I didn't just say that not only does the medical school train doctors, we train masters in a variety of things, such as biomedical informatics. We have PhDs that graduate, but we graduate more bachelors, more undergrads than anything else. So there's about 200 people who graduate from undergrad and shake my hand and get a degree from the Jacobs School every year. We're the 4th largest undergrad school at UB.
Wow. All right, I want to switch topics away from primary care, but we are going into, is the suite
primary
here
care, is it that
or
way?
is it down that way?
Look at where that suite was. That way? Yeah.
Going down this way.
Sorry, I got a little turned around. Let's talk about funding, federal funding. We have had that in the news quite a bit in terms of, I know you guys do a lot of clinical trials and some of that is done across the street. How has a cut in federal funding for specific things like clinical trials, how has that impacted UBMD?
So we're all concerned about potential changes in some of the indirect funding models. On the other hand, I'm very pleased to say that our largest grant at UB ever, which is almost $29 million, has been refunded, and it's going to be around for 6 more years. And so that's terrific. And we also were able to resecure some of the grants that had been cut, and then we got them reinstated. So we feel like we're in good stead, and the school heretofore has had incremental increases in research funding every year, and we're continuing to put in grants, and we're expanding the portfolio to include not just NIH, but something called PCORI, which is another mechanism working with industry for clinical trials, and also developing things like new drugs and using AI to really advance science.
How much of AI is going to be a part of your future? I imagine it's a ton. We did a couple of stories months ago, I think, on the Alpha, right? The Alpha computer that UBMD got, right? Was it Jacobs or was it?
It's really UB. It's part of Empire AI, which is a public-private partnership.
Which was a huge, huge announcement for UB.
Yes.
I imagine it has to have some kind of medical application, if not a ton of medical applications.
Oh, yes. The medical applications of AI go all the way from drug discovery at the basic science level. We've been very successful in that realm, and it is already, we did seed funding from my office, and then that led to already several large NIH grants. So drug discovery, personalized medicine, all the way from how do you be more efficient in terms of your scheduling and your throughput, and AI is being used in terms of making the doctors and the providers' life easier. There's something called pajama time. Pajama time.
I don't know what that is.
Pajama time is where people are in clinic all day or in the hospital, and then they go home and they put on their pajamas and then they do their clinic notes.
Gotcha.
And so AI can be used to lessen pajama time, which is not good for anybody's mental health, to work all day and then do all your clinic notes at night.
I already have doctors who are doing that, who say, is it okay if I turn this AI app on?
Yes.
It just takes some notes for me.
Yes.
Oh, that's interesting.
Yeah.
So it is really being incorporated. You're seeing it now, even in your primary care.
I already see it, because
Really
I've
cool.
had a doctor tell me at the end of her day, she was spending 2 hours of her own personal time writing down notes and also going off her own memory of said notes, but this AI is kind of doing that for her.
That's right. And I think one really important thing about AI is no matter where you're using it in medicine, it is a tool. It is augmenting. It is not replacing. So people worry that somehow, the doctor is going to be replaced or the nurses. It's not. It's going to do exactly what you say. It's going to be a tool to augment, make care more efficient, but it's never going to replace physicians or bedside providers. Just that's not going to happen.
Good thing. We are so lucky as a community to have a facility of this caliber here. What can people expect over the next couple of years? Here we are talking about AI. I feel like every week we get a release from UB about a new thing happening at UBMD and with you and your staff. What can folks expect? Because I don't think really our public knows what an incredible resource this is. I mean, nationally renowned, like all of these things right here in Buffalo. We don't have a lot of that stuff.
Well, so I will say that UBMD, I'm also the presidency of UBMD, so we've got the Jacob School of Medicine part of UB, and then we've got UBMD, and those are all of our faculty that care for patients. And those faculty are 650 plus. They are everywhere. They are the doctors of the Golisano Hospital. They are most likely one of the emergency room docs that you interface with wherever you go. They are the pathologists that are taking care of your tests. So they are everywhere. The orthopedics, Les Basson is one of our chairs of orthopedics. It's just, we're everywhere, and I think that's one thing that is important to know.
Yeah.
So, healthcare at UB is just spans, we have 6 schools of health, including the medical school, social work, nursing, dentistry, public health, and pharmacy. And then the Jacob School is training. We're in K through 12, so people can see what science is about, and so we can inspire students to go into some type of health-related field. Then we have our bachelor's, which is the 4th largest. We have our master's, our PhD, and 180 medical students. And now the primary care initiative, which will put, when fully funded, 15 new primary care docs, so we'll go up to 195.
Specifically for East Side, West Side, you were saying?
Yes.
And the expectation of timing on that?
Right, so it's a proposal that's at the state. We just got some of the funding from the state, so we are getting all the gears up, and hopefully, if all is approved, we'll try to admit our first class probably in the fall.
Nice.
Great.
It's great.
Well, Doctor, thank you so much.
This has been
Well,
fascinating.
my pleasure.
Yeah.
Thank you so much for
This has
coming
been
by.
wonderful.
And yes, and we the building is open. We welcome people, and we love having people come down and visit. So come back.
We will.
We will,
We definitely
for
will. There's a
sure.
lot going on.
Yeah, and we saw there was somebody who was the head of AI waving to us, and we want to talk to him.
Yeah, we do.
He's our
At some
drug
point.
discovery guy. Yep,
Right.
he's the largest user of the Empire AI across all of UB.
Stay tuned for him because he's going to come up next on Buffalo Brief at some point very, very soon. Dr. Brashear, thank you again. We appreciate it.
My pleasure.
Thank you again for joining us for Buffalo Brief. We'll see you tomorrow.